Hi, everyone. I'm Dr. Diana Bittner, co-founder of True Women's Health. And tonight we're here to talk about the gut biome. It's March, which is Colon Cancer Awareness Month, the perfect month to talk about poop and all things related to the gut. I'm here with my partner, Dr. Celia Egan, and she'll talk and introduce herself. And we're so glad to have Kim Murray with us tonight. She's a registered dietitian, a chef, self-proclaimed chef, and
Yes.
is now writing wonderful meal plans that we're all fangirling over on our internal network.
Awesome.
Yes. Well, just to introduce myself, I'm Dr. Celia Egan. For those who are watching for the first time, I'm the internal medicine side of our practice, which means I take care of adults. I've grown in love with taking care of women and talking about metabolic health, which is the way that our body handles the food that it's taking in and what it does with that food. And I love talking about hormones and how they all sort of overlap together. So we really love that our practice has so much synergy in all these different areas. And we've been beyond thrilled to have Kim join us and provide even more content for our patients. It's just been so exciting to see.
Yeah. Kim, would you love to talk about, like, why are you here tonight? Like, why were you interested in joining with True Women's Health?
Yes, well, first of all, thank you for that welcome. I'm very glad to be here and joining you talking about gut health. It's just something that's just really important to dietitians, so tied in with nutrition. So, of course, I wanted to be a part of that and learning from you ladies. So I'm just glad to be here.
How did you get into your work? Like what drew you to being a registered dietitian and chef?
Yeah, so I went to school many years ago to be a dietitian, back when nutrition had it was a lot different than it is now. But it has been such a great skill to have, such a great life skill to have, to understand your body and really how you feed it and how you apply that to taking care of your family, taking care of yourself. So it's become a full life thing for me, not just my job, which has been great.
Kim, I know we're going to talk a lot about the gut today, but I just want to bring up that one of the reasons that we have sort of collaborated so well is because you work a lot in dealing with people who have addiction patterns. And, we talk a lot about that and how women make food choices. And there's some of the same common neuropathic threads that are there when we're talking about food and learning just to live with our bodies and be okay with some of the food intake that we have. And we really bonded over trying to figure that right path for women out.
Absolutely. There's a huge connection between substance abuse disorders and eating disorders, and just the way the mind is so connected to the gut, and definitely the patterns that we have in our thoughts, and how that applies to what we eat and what we choose to eat.
Yeah, cool.
Yeah,
it's been so exciting.
Yeah, and what I think is so crazy is just all the interaction that we're learning about in terms of how gut bacteria impact our neurotransmitters, right? Our serotonin, our norepinephrine. We'll dive deeper into that, but then how all those signals also, the taste of food, the dopamine that comes from food, all of those that then feed back to our brain. So, it's then how can we talk about food as a positive force in our life and have boundaries around, enjoying the flavors and the tastes and all of that without then overdoing it to then be a negative force. So what I love about your menus for us, and again, your input to True.
Yeah. Thank you.
So, and just a reminder to all those who are watching, if this is meant to be interactive, we're meant to field questions. So you can always pop up a question in a chat or a comment. We really do love to answer people's questions. So don't feel like you're interrupting us. We will pause and try to throw up comments as able.
Love that. Do you want to get into the gut biome? Like, what is the gut biome?
What the heck are we talking about, right? So let's take a step back further and even talk about what is our gut? What is our GI tract? Very interestingly, which is kind of fun to think about, our GI tract is actually outside of us. So from our mouth to our butt is actually a completely different tube than what's inside of our body. And so when we go to eat food, we're putting that food into that tube, and our GI tract, everywhere from our teeth, the saliva, the chemicals that make up our saliva, our tongue, down through our esophagus, our stomach, our small intestine, which is designed to take up all the food, then our colon, which is there to repackage it all into waste, and then obviously our rectum and anus is where we evacuate that, is all one big separate process. And boy, is it important. We hear about it as doctors, I would argue all the time, different aspects of our gut health and questions about our gut and symptoms that can come from our GI tract. Our gut microbiome is the bacteria that live in that tube, and they live everywhere from our mouth to our bottom. And when we think about bacteria, some people feel like, ew, gross, right? Like I have bacteria inside of me. But honestly, this bacteria is really, really healthy. And it does a lot of it's interactive in a lot of the different messaging that our body is doing. So it's imperative sort of to keep that bacteria healthy. So when we're thinking about those different bacteria, there's millions to billions of different types of species that live there, meaning slightly different types of bacteria. What we hope is that the right species are growing and thriving at the right time. And unfortunately, in our world, we can consume, or there can be environmental things that can shift those species of bacteria, and then one species can kind of flourish and overwhelm the system. And sometimes that can lead to somewhere of mild symptoms, like maybe just some basic bloating, to really bad symptoms, like your whole colon can get super inflamed, and you can have diarrhea or bloody diarrhea. And that would be something we call like Clostridium difficile, or C. diff is another name for that. Both are the same concept, which is a bad bacteria sort of has grown up, but the outcomes are completely different. Obviously, a lot of women can have some subtle symptoms, but we are also concerned about small shifts in those bacteria that can lead to be part of like chronic disease and a low, like simmering level of symptoms that women can have. And that's what we can talk a little bit more about.
And Kim, how do you see the gut biome in your world and from your perspective?
Well, I would say, starting with like what we mentioned before about the connection between the gut microbiome and our mental health. In the practice that I do, I see a lot of that, and we talk constantly about the way that neurotransmitters are made in the gut microbiome, how the process of eating fiber breaks down in our gut, produces short chain fatty acids like butyrate and propionate and acetate, and then all those go on to just do all this magic in our gut microbiome. There's so many great things about it, from obviously neurotransmitters, immunity, and it just goes on and on. So yeah, I see a lot of that, and I'm happy to talk about fiber or different kinds of fiber. And
before we jump into that, I just want to point out something that you said, and we like to talk about this in sort of just like a connection chain. So when we input anything into our GI tract, so whether that's food, water, another liquid such as alcohol, a medication, that can shift the environment by which those bacteria are living, and therefore shift the species. Any of those species are making, as they digest that food that we're eating, a byproduct. And those are what you were talking about, the pyruvate and the butamate. Those byproducts then can change the way our GI tract cells respond to the rest of the world. And it does feel like this kind of stepping stone that can be a bit overwhelming to sort of think about. And we only mention it just to speak of how intertwined all of our everything from the stuff that we're ingesting to downwards of the cellular messaging that our GI tract is giving, and how important that chain is.
Well, I think it's really fascinating. Even it depends on where you live. So, for example, if you go to France for 2 weeks, you'll totally change your gut biome, right? By eating not only
Yes.
pasteurized, but just, being in a different environment. We know that babies born to, as an obstetrician, I would be remiss if I didn't mention, but babies born to women by C-section, those babies have a higher risk of ulcerative colitis and inflammatory bowel disease because they don't get to come through their mom's vagina, and they don't get to be exposed to all that original biome. And so it's just so important that we think about that. I saw a study of kids raised on Amish farms in Ohio where the cows lived right outside the door, right? The field was right outside the door. Those kids never have asthma. They never have bowel issues. They don't get colds, right? But even when the kids who had the farm down the street, they had asthma less, but still a little bit more. And then, of course, city kids, more asthma because they're not exposed to all those bacteria in the poop and the air. So it's just truly fascinating.
Absolutely. And I think what's crazy is that we're just beginning to know, there's trillions of bacteria there. So we can throw out a few that we maybe know are influencing certain types of things, but we're just at the tip of the iceberg of learning all the exciting things.
So for example, MIT, go ahead, Celia.
Every obesity medicine conference, I'm like waiting for like I always joke the poop pill, because every conference there's several talks about the microbiome, and we know that in animal models we can see the shifts and changes with microbiome depending on whether different mice are carrying extra weight or not. We know when people have case reports where they have to do a fecal transplant because of severe Clostridium difficile or severe C. diff, that they will be a person who's never struggled with weight, and then all of a sudden now they struggle immensely with weight.
Because those bacteria came from someone who was overweight.
Right. Yes, I remember reading that study.
So all these different connections, but we've not been able, not yet in my space, have we been able to encapsulate it to say, oh, here's exactly what you need, right, in order to kind of do to keep your weight at a steady state, even though we know that there's all these sort of connections there.
Yes.
And you wonder too, like I know the company, I'm not promoting this company, but a company called Pendulum, where they're really working on Akkermansia, a certain type of bacteria that apparently is really linked to colon cancer. And so we'll get into that. But, one of the questions at hand is why does it seem that so many young people are getting colon cancer way before? Lost a dear friend to colon cancer at the age of 38. It's just, way before otherwise he would need screening. And, is it related to diets that are low in fiber and the bacteria are off? We don't, right? There's a lot to learn.
I think it's so hard because it may be low in fiber, but high in plastics, right? There's all these different things really matter in shifting our microbiome. So Susan asked a question. With home tests like Biome, how does this type of information help one inform their food choices? Great question, I think. And we hear this question a lot in the office. I don't know, Dana, do you want to give your beginning 2 cents of the stool testing of what you've seen?
We're learning how to use this. I mean, can it be helpful? It's so important to know, like, first of all, how might it change? Number one, it's about fiber. We're going to talk about that. So I want everyone eating lots of fiber anyways. Are there certain nutrients or certain supplements that might help support the bacteria? Potentially it helps. It's just the science is so new. Whenever you talk to even someone like the CEO of Pendulum, who is a microbiologist doing groundbreaking research, she says the science is so new. I've heard her on several podcasts, the latest one with Peter Attia, and she says, I don't know what to do with a test like that. So I think I really applaud people on trying to understand more. But again, we can't say this is the end all be all.
Yeah, one of the things I think we worry about is the accuracy, because you have to remember, like, the second that poop leaves your body, that bacteria is already shifting when it gets exposed to water and air and heat and cold. And so we worry a little bit that, like, are you, not to get graphic, but like literally taking that poop from your colon and then when you ship it, is it going to be exactly what it should be? That's what I worry about. And then that information then sort of becomes void.
Yeah.
And I haven't seen anything yet where, as Dr. Benner had mentioned, where there's just this clear link, like I took this poop sample, I did this, and effectively we've been able to change either symptoms nor disease processes. So, we don't do that at our office, only just because we can't validate some of the testing. But as Dr. Binder said, I applaud anyone who wants to continue to learn about their body, and we're always happy to field some of those questions.
But Susan, one thing that makes me crazy about this is that, I'm just concerned that these companies are preying on vulnerable women. Let's say you have irritable bowel and you're trying a lot of things. I have a dear friend right now who's struggling with gut health, and so for the Biome, you're going to do a poop test that costs how many hundreds of dollars, right? And again, we don't even really know what to do with the results. We really don't know if the results are accurate, but yet you just spent how much money. So again, I'd like to think that all these companies are made with the best intentions, but unfortunately, when there's money to be made, I just worry about that. So again, just, it can be a curiosity, see if it changes anything, but just be careful of some of these companies.
Yeah.
I think it's interesting because a lot of people will get hung up on these certain strains, and they'll think, oh, I'm low in this or whatever. And really, when it comes to food, maybe you can manipulate the type of fermented foods you're eating to kind of manipulate those types of strains, but it's really just fiber. It's like putting gas in your car. You're just giving it gas. You don't need to understand how every little component of your car is working. You're just feeding it the gas and it's running. So if you get a test back like that and you can't understand it, or you don't know what those strains are, as far as nutrition goes, it's really the same answer every time.
And I think it's also very difficult because, as Dr. Bittner already mentioned, you even go to a different part of the world, or even eating fruit from lower Michigan to upper Michigan, a cherry is different, which is crazy to think about, but it's true. And so now if you're getting a test saying, oh, you'll feel great eating cherries, and it's like, well, cherries from where? Cherries from France, cherries from the Upper Peninsula, cherries from the Lower Peninsula. And so, unfortunately, our food varies so drastically that it is just less helpful to have some of that information.
Yeah.
Kim, I think you'd crack up at this. I had a patient who said that all of her friends were doing the poop test, and she had a dinner party, and they all emailed her their poop cards so she could plan her menu around her friends' poop cards. Like,
oh, no way.
What? Like, oh my God, like somebody couldn't have broccoli. I'm like, broccoli? Why can't you have broccoli? Like, I don't know. So again, Susan, so interesting, but like, come on, a little bit ridiculous. The other thing, just real quick, is to mention the gut biome. Again, as the gynecologist here, the gut biome also affects the vaginal biome, and the vaginal biome can be so tricky. And again, the science is new. I had a patient who really I struggle to understand. We did a culture of her vagina microbiome, and she had no good bacteria in her vagina, and she had E. coli. And of course, the test was very important to understand. We finally were able to get rid of the E. coli, but it's been such a challenge to get good bacteria back. There's no pills for the vagina. You can't put yogurt in your vagina. It doesn't really work. So it's a real challenge. And again, like Kim said, it's about the gut. It's about experimenting with different foods, which we'll get into. So, it's a challenge, and we're up for it.
Someone else has a question. Let's see. Love this. My husband and I are trying to dial in food to help with our gut health. Kim, cool. I think you said it. Fiber, but
I know. I love that. I'm like, oh, yay. Somebody really wants to talk about it and is interested in hearing it. So, so fiber is the key here. So fiber is basically, it is the non-digestible part of the plant food. So it basically can't be broken down in the body completely. There's two different types of fiber. There's soluble fiber and there's insoluble fiber. So soluble fiber dissolves in water and becomes kind of like a gel-like substance in our gut. Insoluble fiber does not dissolve and really adds just more bulk to our stool and helps prevent constipation. Soluble fiber is the nourishment for our good bacteria. So it really is about fiber, fiber, fiber. So the sources of fiber are black beans, lima beans, kidney beans, all sorts of beans obviously are good sources of fiber. Vegetables, Brussels sprouts, turnips, sweet potatoes, broccoli, different types of fruits with the skins on them, nuts and seeds, flax seeds, chia seeds, all those very good and high in soluble fiber. Insoluble fibers, more wheat bran, quinoa, peas, cauliflower, all cruciferous vegetables, almonds, soybeans. The one thing, though, is really interesting is that most foods that are a good source of fiber are a good source of both soluble and insoluble fiber. So I would not get real hung up on, I really need soluble fiber, I'm only going to eat these foods. If it's a good source of fiber, meaning 3 grams per serving or more, then I would consider, that's a good source of both types of fiber.
And I don't know. Oh, we can ask. Aaron has a question. Aaron Weber, to ensure you're getting enough fiber, what are the best supplements? Sometimes it's hard to set enough fiber while also ensuring sugar in check, calories in check, protein. I know. So, Aaron, there's so much to watch. I hear you, sister. Do you have any supplement recommendations, Kim?
You can take psyllium husk fiber, which is like Metamucil. That is a good source of soluble.
Fibercon is my favorite. It's the pill form of that.
Yeah, absolutely. Just I guess it doesn't really, matter whether you use the pill form or you use the chunky stuff you add to the water. I like something called sun fiber, which is a guar gum. It's particularly good for people that might have kind of a IBS symptoms going on. So it seems to settle better. I have a little package I throw in my water. But, as far as supplements go, I always say you can't really supplement your way out of a bad diet. So we always, and I understand that sometimes it's just hard to get the amount. But chia seeds, flax seeds, throw them in everything. Those always give you a good source.
I love what she says.
Go ahead, Dinah.
I love what she says about how can we ensure like our sugars in check, calories in check.
Yeah.
And I think about the top 5, right? Like broccoli, we're good on the sugar. Berries, they help keep our blood sugars nice and stable. They're not super high in sugar, but again, it's more about they're just so high fiber with 8 grams of fiber per serving. You look at avocado, super high in fiber, right? With healthy fat, 10 grams of fiber per serving per avocado. So it's like thinking about those things can help keep our sugar nice and stable at the same time we get fiber.
Yeah. I think adding chia seeds, hemp seeds to common dishes are shockingly tasty. Like if you're to puddings and stir fries and stuff, and people forget like bite for bite that they're actually getting in more fiber. And the calories that we consume from something like a chia seed, and Kim, please correct me if I'm wrong, but it is a little bit different than a calorie that you would get from like a cracker. Just the bioavailability of it is so tied in with the structure of a seed that in comparison to something like a cracker or a Dorito, which has been pulverized wheat or corn and like will disintegrate like this in your hands, all that calorie is available to be consumed right away. And so I think less about overdoing calories when people are talking about adding like hemp seeds and chia seeds to things, just because I know they're just not going to absorb it in the same capacity. And it's never going to get into their bloodstream to be looked at.
Celia, I love your example you told me once. I think when we first met, I was putting all this fruit in my smoothies, right? And you were like, you didn't suggest it. I asked your opinion and you were like, well, yeah. So it's like the best thing is a whole, let's say, berry, right? Because the fiber and the sugar are all together. So they're going through the gut at the same time. Like I was doing, if you just smash it up in a smoothie, then the sugar and the fiber are separate. So more of that sugar is going to get in the blood quickly. And of course, the worst thing, which you made the point, is juice, where there's no fiber at all, right? You just smoosh out the sugar from the fiber, throw the fiber away. Yep. And then you're with that sugar. So I stopped putting berries in my smoothie. Thank you. And I will eat them separately. So that to me really made sense.
Yeah. Cool.
Great
And then
idea.
Susan had another, I keep saying, Susan, I'm so sorry. For some reason, I keep wanting to call you Sarah. You definitely feel better after eating real food. Amen, sister. What are
Yeah.
your feelings on products like Groons, Reese, AG1?
I'd never heard of these. Have you guys?
I haven't
Yeah,
either.
yes. Oh, they're like vegetable supplementation supplements.
Oh, okay.
You know, I think when people are really struggling for whatever reason to get vegetables, right? Maybe you travel all the time for work. Maybe you have some texture issues that you're working on, right? That you just can't get those veggies in. You know, I think that if you want to try that for a while and it makes you feel better, I think that that's not the wrong answer. As Donna was talking about the same concept with the poop studies, I think people are desperate to be healthier, and people and companies see a void there, right? And they'll say, okay, yeah, you know, if you spend $80 a month on my supplements, like it's gonna make you feel amazing. I think it's hard because a lot of people will make health switches all at one time. So when someone goes when they come in to see us, for instance, sometimes they're maybe not exercising, they're not sleeping, they're not getting enough water, they're barely thinking about whole foods. And we're like, okay, let's get you to sleep even a little bit more. Let's get you to drink water even a little bit more.
Yeah.
Let's start adding in whole foods. And they add in AG1. And then they're like, oh my gosh, I feel amazing. And you're like, yeah, was it just the AG1s though? Or was it all the other things that you've been doing that have been making you so healthy? And even small twists, right? An extra hour of sleep, 40 more ounces of water, like all those things really matter. And it may not feel impactful in the moment, but we do find that they're so helpful. And so it's just so hard to separate out just because someone started something like AG1 that all of a sudden they feel better. And I don't want to discount anyone who has done that. Everyone's body is different, and that may be you. Great, amen, keep doing it, right? Work with what you got. But we just haven't seen it play out, and I've had a significant amount of people on it, and I just haven't seen a tremendous amount of benefit.
I just wonder, Missy, if you would put up the seeds link. You know, we talk about the 7 essential elements of daily success. And again, you know, I created this back in the day because it's just helpful to have a list, right? Like, I don't know about you all, but I'm a list maker. So if every day I can think about how am I feeling, you know, I go through the list in my head. Did I drink my water? You know, did I get my sleep? Did I take my vitamins? Did I get my fiber? You know, what are my nutrients? What does that look like? Dr. Egan invented the Nourishment Journal, which is just a great way to track, you know, mindful eating. And in the back, there's a chart for fiber and for protein. You know, did I get my activity? Did I do my metered breathing? So again, the seeds list is really important. You can go on our website and link to the seeds ebook, and that can show you as well. But again, it's just going back to this list. Not to digress.
Yeah.
You know, I'm looking at that list and I'm just thinking, you know, the 5 servings of healthy carbohydrates. Well, if you're choosing those, you are almost to the end of getting all the fiber that you need for the day. Yeah. I mean, if you're picking good, healthy carbohydrates, you're well on the road, which is great.
Yeah. Awesome.
You know, a couple of things I was thinking about when when I was coming up with this idea of fiber and how important fiber is in the gut microbiome. I wanted to mention that there are some other things that also play a role from a nutrition standpoint that play a role. One of them being polyphenols. So polyphenols are basically all those real bright colors that you see in fruits and vegetables. You know, strawberries and blueberries and peppers and all those are really high. Yes. Yes. And polyphenols, they play a huge role in our gut. They also serve as a good fuel for the microbiome. So it's not just about fiber, it's about getting the polyphenols. But of course, you know, it's perfect because most of the foods that have polyphenols also have high in fiber. So that's great. And then there's also resistant starch, which is like when you cook a potato and you cool it, or you cook rice and you cool it, or overnight oats is another great example. You see a lot of those in the menus that I write because they are an excellent source of fuel for our gut And again, some of them have fiber and some of them don't. And then the last one is onions and garlic, which are considered like a fructooligosaccharide, which is a type of carbohydrate. And they are considered prebiotics as well,
Really?
because the gut just loves them.
No
And
wonder I love them so much.
yeah, herbs, spices, you know, you can add those. Those are wonderful prebiotics.
That's cool.
That's really exciting.
Yes. All right. Erin has a question for us. Erin, can you talk a bit about fermented foods? How do those work to improve the gut? Recommendations, how much each day? So Kim, do you want to give a definition of fermented foods?
Yes, so fermented foods are just foods that actually have live probiotics in them. So they would be considered things like yogurt and kimchi, kombucha, even sourdough bread does have some live probiotics in it. When you buy fermented foods at the store, though, you really need to check the label that it says live bacteria, because oftentimes, so if you're looking at like sauerkraut or pickles, you can oftentimes see that some that are, you know, made with vinegar, and those aren't really the ones that we're talking about. You want to look for ones that say live bacteria on them.
What I think is really fascinating is, you know, plain yogurt. I was talking with my colleague, Dr. Martins out east, and he's the world expert on the vaginal biome. And again, we were discussing my patient who had like no good bacteria in her vagina. And he's like, just be careful of telling people about eating plain yogurt, because, or just yogurt in the store on the shelf. He says it only has about a 24-hour half-life. Now, he's a microbiologist. For fun, he takes these all to his lab and he grows them to see what's in what. And he said that yogurt, if you're going to get yogurt, you just go to the front of the line and get the newest, you know, most updated, because again, within 24 hours, there's not that many bacteria in that yogurt and it's dead. So that's where the kefir, especially the low sugar kefir called Siggi's, you know, there's Lifeway and there's Siggi's. So Siggi's usually has the lowest sugar of all them. So super interesting about that.
I didn't even know that, but that is good to know. Definitely. So
yeah. Unless I have a patient who makes her own yogurt, that's another thing. Hey, Fran, so glad you're here. Celia, you want to take this?
Yes. Okay.
Or Kim, please.
You are right on the seeds. Sharing that I put benefiber powder in my coffee in the morning, and it adds 5 grams of fiber. The doctor who did my colonoscopy said to avoid processed meats. Can I ask you your opinion on lunch meat, like turkey meat? I have,
one thing I've heard is just, you know, having processed meats, especially like salamis and cured meats, can really increase the risk of stomach cancer. I don't know the data on colon cancer, but that's my concern. And there's just no fiber. So I don't know the chemicals.
So some of this I put in context of, you have to remember when we eat something, we're also not eating something, right? When we make a choice to eat a food group or a food, we're also not eating something else. So in an ideal world, right, we'd have every one of our meals would be something where we'd have whole non-processed foods, healthy, lean protein options with the least amount of processing. But sometimes that's not our reality. And I think that there are some times when you just need a sandwich and at that moment, right, that's the best choice. And it's better than maybe going and having fast food. It's better than maybe just having only simple carbohydrates, like only just a soda and Doritos, right? Which I'm guessing that's not you, right? So if you're like, okay, that's the best that I have for now, find some options that have the least amount of processing. If you flip the packages over, there are some companies that are really trying to have processed meat that has added spices and has already been cooked. So it's still technically processed, but without some of the additives that we're concerned are the cancer causing elements. Should you have nothing but those things all day? No, probably not. But as we're moving through life, I try not to get women to lose too much sleep over those few times that they kind of have to have a sandwich. Kim, I don't know if you have any other thoughts.
Boar's Head turkey sandwich, that's the best.
Yeah, 100%. And I'm just thinking in my mind, if you just took your turkey sandwich, You put it on some good whole wheat bread. You add a slice of avocado to it, maybe some lettuce or a tomato or cucumber or something like that. Then you have created a perfect meal.
Yeah.
Yep. And don't overthink that 2-3 ounces of processed turkey meat. If that gets you out the door faster or whatever, wonderful. Just dress it up.
Exactly. Lisa had a question. Yep. Okay, good.
Lisa,
For Kim.
for Kim.
What's
What
the name
was
of
the
the
name
fiber
of
supplement?
Oh, sorry, go ahead.
You go ahead.
What was the name of the fiber supplement, Kim, that you were talking? I think it was called Sunflower.
Oh, sun fiber. Yes.
Sun fiber.
Yes, it's a guar gum.
Yeah, Lisa, we'll, I don't know if people know this, we've heard that we recommend so many different things that if you go to our website, in the next like 2 days or so, we will post some of, we have a list where we have links to all of our different products that we've been recommending. But in your spare time, I'm sure you could find Sun Fiber sort of anywhere online.
Yeah.
Okay,
And
Dr. Egan.
I can answer this for you. Yes, the
Okay.
Nutrition Journal, Lisa, is in the office. So feel free to stop by.
Stop by when you're in the office. We'll give you a copy. Cool. And just to go back to Aaron's question about the fermented foods, I don't, and Kim, I've not found an amount that is too much. I'd be concerned, like if someone was having too much, maybe if they were having diarrhea, that may be too much, but it's very hard to take in fermented foods. I don't know. Usually people, after 2 or 3 servings, like you're kind of done for the day.
I see all your pickles in the fridge, though. I think you could eat a fair amount.
I do eat a lot of some fermented pickles, but I will say I think it's very hard to overdo it. And if you're picking low sugar ones, so I'd probably stick with maybe not more than 2 of the sugary servings, like 2 kombucha a day.
Yes.
But the brine, kimchi, pickles, olives, that kind of stuff, if you're just adding it throughout the day, I think you'll be okay.
I've heard people recommend just having even like just a tablespoon at a meal. Yeah. That's it.
That's awesome.
Just a little side, just to kind of get a couple different types of fermented foods in during the day. And don't forget to feed them because they need fiber. You can, if you're just eating the fermented foods and you're not feeding them fiber,
it doesn't work.
They're not doing well.
Great tip. I love it.
Yeah.
Kim, this is for you. Why overnight oats? Hey, Judy, great to see you. Miss you. Why overnight oats versus steel cut oats warm in the morning?
I mean, it would be totally fine to have steel cut oats. They have wonderful qualities as well. I just mentioned the overnight oats because they are a resistant starch, which seems to be something that the gut microbiome really likes. So they're both good.
Anna, I make my own sauerkraut. How do I know if it has live bacteria? I've not made any. I would think it's fermenting.
Kim, do you know that?
I would guess if you're making your own, that and you're following the process that you're supposed to be following it, and you're seeing all of the signs of live bacteria, little bubbles, and all of that sort of thing, then I would say definitely there is some sort of live bacteria. I think it's impossible to really measure exactly what kind and how much, but
I think the bacteria comes from a type of acid or base with a fiber. So sauerkraut is cabbage that's been treated. Yes. And then as part of that treatment process, that's where the bacteria grow.
Yes.
So my guess is that if you're I think sauerkraut is one of those things where like that inherently is part of the recipe, is that processing.
Right.
Yes.
And so just like sourdough, right? When you make when you make sourdough, it starts to ferment and bubble, and then you have to feed it, right? You're feeding it the fiber from the rye flour or whatever you're using, and you see the bubbles and it's warm and it's feeding those bacteria. That's how you know it's working. Kombucha, right? You take off the lid and it's in there.
Yes.
I think what Dr. Bittner was talking about with the yogurt is I think sometimes the bacteria in prepackaged things can die. So if someone's making yogurt and then it sits on trucks and is shipped around, that is like normal yogurt at a grocery store, that probably won't have any active bacteria in it, and that's why it's less helpful.
Yeah, exactly.
I have made my own yogurt before. It is so easy.
I would like to.
It is literally 3 steps.
3
Do you
steps.
have
Oh my
a
gosh.
fancy maker? A
No,
yogurt?
I did buy a little maker on Amazon, and it looks like a tiny little crock pot, and it sits on my counter for 24 hours after I do my 3 steps. That's it. It's so
Really?
good.
Cool. That's
Yeah.
That's
fun.
awesome.
Easy.
All right. Well, thanks. That was a great question. What are your thoughts on intermittent fasting for women over 50?
Go for it, Celia.
Okay. Very similar to the deli meat question. I think it really depends. One of the things that I think we've learned that has been very impactful from the intermittent fasting world is some people can't eat all day, right? So some people do not do well the second their eyeballs pop open, eating a ton of food till 11 o'clock at night when they're munching on popcorn. I think that's something that we've found benefited from the intermittent fasting world is that it'd be nice to have some closed end blocks. Now, that timing per person, I think, really varies. Some people really like intermittent fasting and it fits in well with their schedule and they're able to maintain appropriate nutrition. I think one of the things that I worry about when I see intermittent fasting is women just don't eat enough protein, they're not getting enough of their nutrients, not enough fiber. And so then we worry that we're just making some changes that we're not going to like, maybe to our microbiome, maybe to our muscle mass, and that's less impactful. Now, one thing I do not like at all is I'll have some women who will do intermittent fasting and they find it really distressing. Like they'll be like, oh, like my window blocks not till noon, but everyone in my family's having brunch at 9 and like, what should I do? And I want to eat, but I'm like staring at eating and I shouldn't, and it's not my block, and that we can't have, right? So if you have something where you need to eat outside your window block, which is what they talk about with intermittent fasting, is having these times throughout the day that you're not
Eating zones.
eating zones, then if you're distressed and you're missing out on life, then we got to open your block for that day, right? And trying not to get too consumed with the idea. Don't let the idea of eating within these zones control your emotions. So that's my 2 cents. But I will say within the weight loss world, there's some interesting data about it. Not specifically looking at women over 50, but global evidence, I will say.
Right. I remember the most convincing presentation I've heard was for women in menopause, especially with more insulin resistance, less insulin sensitivity, that the more effective method is, let's say, 24 hours once a week or 48 hours every 2 weeks. So it's that block to really affect your insulin resistance at the level of the liver. So I think the big push for intermittent fasting, especially for women when they're insulin resistant, is sort of over, and people are looking at different ways.
Things. I will say, I think one thing to reflect on is nighttime eating. I don't really think nighttime eating is that healthy for anybody. It is rare that I have a patient that's like, oh, I was eating steamed broccoli at 10, right? People are usually consuming treats. Usually, by this point, our prefrontal cortex is exhausted from the day, right? And we're running kind of on autopilot, and boy, does autopilot love treats. And so if I were to just hit my toe into this, I would just say, look, I had dinner, it ended at 7, that's it, right? Maybe I'll have a cup of tea or water, but I'm done. And if I'm really hungry, like I need to eat more at dinner the next day, right? To kind of carry me through.
No, I think
that's a good place to get started.
Lisa would like a recipe, I'm assuming, for the yogurt. Is that something that...
Well, I don't know if I really have it off the top of my head, but it's basically the 3 ingredients of it's a probiotic pill, it's an inulin fiber, and half and half. That's it.
All right, we'll set. I'm sure we can get that, Kim. We'll send it out and we'll post it.
Yeah. Alessandra, Allie has a question. You see it, Missy? There we go.
Pizza made.
So technically, a pizza made with yeast and left for 48 hours contains a probiotic. Yes, except for I think if you cook it again, then it wouldn't. No.
Pizza made with yeast. Well, you would need a source of a bacteria to make it a probiotics, or to make it is she meaning like a fermented food?
Yeah, but like yeast is a fungus, right? So I don't know that yeast is a probiotic in the same way.
Yeah,
I've never heard of. I think it depends on how you make it, but Again, we can look that up, Alexandra, and see if we can get you a recipe if we find one.
If it's made with sourdough crust, then yes.
Yeah, I guess.
There you
Yeah.
go.
Mhm.
There
Oh
you
boy,
go.
we're getting a lot of questions. Okay. Mike Mary Gray. Also, heavy lifting versus cardio. Oh, I feel like that's a whole other Facebook Live, friend. But
But yes,
yeah,
we need both.
yeah, you need both. Try to carve in time for both. If you're feeling like you're having some pain in your joints, it may be helpful to spend some time getting stronger with doing some heavier weightlifting, just to get those joints a bit protected. I don't love the idea of people just out of the blue just running, because that can be really hard on your joints. So it can be good to start with some weightlifting if you wanna, if one of your goals is to be a runner the best of your
And
ability.
as we think about food and processing, I love sourdough whole wheat bread, right? If I have more muscle, I'm more insulin sensitive, and then I can have my sourdough bread. So again, it all goes together.
Yeah.
Yeah.
I think so many great questions. Is there any blood tests to test for the microbiome? No, there aren't, as far as I know. And the reason why is because that microbiome actually isn't inside our bloodstream. It communicates via our GI tract, but none of that bacteria actually leaves the tube that is your GI tract and goes inside your body. And actually, people get really sick when that happens. So for whatever reason, you can have a really bad GI tract infection or
Diverticulosis.
diverticulosis, which is an outpouching of the colon. Obviously, any sort of trauma to your abdominal cavity, or in surgery, people can nick the GI tract, the intestine, and that causes a bunch of problems. So no, there isn't really a connection between your microbiome and your systemic blood system. That being said, we know that those communications are very strong, and I wouldn't be surprised over the next 5 to 10 years as this research develops, that they may find some downstream signaling that may be helpful at correlating which microbiome is there, but there's none that I know of as of right now.
Not right now.
Yeah.
Before we get too far along, I think let's just at least briefly talk about colon cancer. I know that's
Yes,
something we want
yes.
to make sure we address tonight, in terms of, fiber and bacteria really do affect our risk for colon cancer. Again, have heard some great podcasts. So, but just maybe talking about what is basic screening. So, and how did that recently change?
Yeah. So, colon cancer, our colon is the last part of our GI tract. It is there to collect all the leftovers that after our small intestine has taken up all the nutrients and goodies from our food. The point of the colon is to take water from that leftover waste and make it into stool and hold that stool. And then when we're ready to go poop, we're ready to go. Colon cancer is a uncontrolled growth of those cells within that colon. And unfortunately, it can grow without being seen or heard or felt. And a lot of the times, by the time we wait for symptoms to develop, which we can talk a little bit more of what those are, it may have gone to other places in our body. And obviously, people die from colon cancer. The rates of colon cancer are on the rise, unfortunately, as Dr. Bittner has said. So it's really important to reflect on your risk of colon cancer and to think about if you're a candidate for screening. For a long time, sort of the only screening method that we had available, which is still the standard of care, is doing something called the colonoscopy. And that's where we take a gastroenterologist, a specialist, would take a camera and look within the entire length of your colon, and it's looking for abnormalities. So of course that provider would be looking for cancer, like a mass that it would see, but it's also looking for precancerous cells. And that's why the colonoscopy continues to remain the gold standard, is because not only can we look for cancer, but you also can look and treat precancerous lesions. So if they see something that we'll call a polyps, they'll take that polyp away and essentially have, maybe it would have prevented you from that precancerous colon polyp developing into a cancer as years have gone by. Not everyone loves colonoscopies. The world heard that. So there are other tests. The oldest test was basically they took your stool and they looked for microscopic blood. as you can imagine, especially for a woman who may be having some menstrual bleeding and or other sort of just irritation in her vaginal canal, that can create a lot of what we call false positives because we're not really sure where that blood came from. And a colon cancer mass may not have always been bleeding at the time that a sample was taken. So we sort of, man, it's been a long time since I've ordered one of those. Ooh, years, if not longer. The newer stuff that's out is taking a stool sample. So we're still not doing a colonoscopy, but we're still taking a sample of stool, but we're looking for cancer-specific immunologic cells. So a little bit more specific for colon cancer itself, right? We're ruling out kind of other skin irritations or other reasons to see an irritant within the stool. It's still not as sensitive and specific as a colonoscopy, but it is an option for people. The more recent the more recent FDA-approved versions of colon cancer screening is looking at for cancer cells in your blood, which is quite exciting. We've talked a lot about screening cancer from looking at cells in our blood and other Facebook Lives. And we use it not just for colon cancer, but there's a lot of different, there's one company that we rely on called Gallery, and that's just been the company that we've chosen. But honestly, there's several companies that are coming out looking for cancer cells within blood. There's now a specific FDA approved version, and we have available in our office, and I actually don't remember the name of it, but you can have a blood test drawn and it will look for colon cancer cells. Nothing is better than a colonoscopy, and I'll say that again. Nothing is better than a colonoscopy, but as everything we do in medicine, we should offer people different options because not every person is the same. Not every woman.
When should women start a colonoscopy?
Yeah, so the typical screening starts at age 45, or everyone at age 45, or 10 years younger than your first relative that was diagnosed with colon cancer.
First degree.
First degree. So if you had and I think it's actually grandfather. I think it's the next round.
Second.
So second degree. Yeah. So like if you had a grandfather or a brother who had colon cancer at 45, you start at 35 looking for cancer. Because again, it's just really not something that we want to miss.
One thing I think is really curious about gender-specific difference is that women tend to develop colon cancer in the right colon, which is a lot slower to show symptoms. So, we talk about symptoms like bloating or pain or change in bowel habits or blood in the stool. But unfortunately, women tend to develop that cancer on the right side, whereas men tend to develop cancer on the left side. I don't know why. And so men tend to have symptoms a lot sooner than women. So again, it's just to pay attention. Even if you have a vague something, I believe in the 10-day rule. If you have a something that's even vague, pressure, discomfort, whatever, if it's more than 10 days, we got to know. And that's how we can start looking for stuff. Don't blow it off. Don't just deal with it.
Yeah. Yeah, I agree with that. I think that anytime that we have something that is bothersome, particularly bloating, anytime that you see blood in your stool, that really is a warning sign of something that really shouldn't happen. A lot of the times it is nothing because it can be from downstream, right at sort of the bottom where all that stool evacuates. You can get like a hemorrhoid and that can cause bleeding. But anytime that we see blood mixed in with the stool, it's something that you got to talk to your provider about to make sure that we're doing a full workup and making sure that all of your colon cancer screening is sort of up to date. The other thing that we think less about, but is still important, is if you're having a worsening iron deficiency anemia, what does that mean? That means you're slowly losing blood over time. And a lot of times in women, we'll see this because of their menstrual cycles. Obviously they're losing blood every month and they just don't quite have enough iron to keep up. But as women go through perimenopause and menopause, and maybe they're having less menstrual bleeding, and then out of nowhere, they have a new iron deficiency anemia, that is a definite plan to do a workup for colon cancer to make sure we're not missing some other GI tract cancer.
Anna, your question, I remember reading a really good paper about this, and it really is if you don't have polyps, right? So 10 years is generally enough because it takes a long time for polyps generally to turn into cancer. And so if your colonoscopy is negative, completely clean, and they've done a nice slow job of pulling that camera out, looking well, if your colon was nice and clean, it really is okay for 10 years. Now, if you have polyps, some polyps are faster growing than others. It might be 3 years, it might be 5 years. So if your colon's clean, you're good for 10 years.
Yeah.
I'm on the 10-year plan right now. So
and I will say, and I believe the future is going to be doing more of these cancer screening blood tests. So my guess is that you'll have a screening option of choice at some point over the next probably 5 years. I feel like that's going to be a lot more mainstream, if not like part of our routine cancer screening. I mean, we'll see, but that's sort of where we feel like the vibe's going. Yeah.
Perfect. The last thing I want to address before we maybe get to our, I can't believe we've been here almost an hour, but
I know
the power of an antibiotic. So, recently I had to take Augmentin for a really bad sinus infection. I was pounding the fiber and the kombucha. So it's just, what is that? Can't even talk. What is that antibiotic doing to our gut biome?
So, I mean, antibiotics are, the whole job of an antibiotic is to prevent the growth of bacteria, if not break down the bacterial cell walls. It's great at what it does, and thank God we have them. But but on the other hand, it's not specific just for, like, if you have a sinus infection, just for the bacteria within your sinus canal. It will wipe out all the bacteria that's there. So whatever you can do to support the good bacteria in your microbiome, the better off you'll be. In general, we're trying to find this balance with antibiotics, right? I think for a while, like anytime anyone had any little sniffle, we gave everyone antibiotics. Now we're trying to really limit that. I think we'll land somewhere in the middle, right? And we try to have a really patient doctor conversation about the risk and benefits of using antibiotics at that point. But I think it's always just worth a pause just to think about your gut bacteria.
Do I really need them?
Do I really need them, right? It's not a hard no. It's not a hard yes. It's just a pause and a conversation.
Well, Anna has a quick question.
Is it true that polyps can be shed by your body? No. Polyps are almost like a mole on your skin, but in your inside GI tract. And just like a mole on your skin, some moles are not dangerous. They're there and you can see them, and they're not normal because not every person has a mole there, but it probably won't affect your life in any way. But just like a mole on your skin, there's some moles and skin lesions that are bad and will progress and can do some damage. So no, I do not believe that you can shed polyps because it's sort of an outgrowth of the cellular tissue that's lining the colon wall.
Exactly. And Jennifer, thank goodness you advocated for yourself.
Yeah.
Thank goodness it wasn't cancer, but
sharing.
Yes. And also to that point, I really strongly as a gynecologist believe in rectal exams after 26. That's just been stuck in my mind. Early on in practice, a partner's patient was in the ER. She had multiple ER visits for rectal pressure, never had a rectal exam, and she died of rectal cancer and left 3 young children. Like just make sure when you see your doctor, you have a rectal exam every year. I have found several rectal cancers already here at True Women's Health in the time that we've been open, just by doing that rectal exam and finding a polyp. Some people have really small ones. Sometimes they're big ones. Like, just have a rectal exam. It takes 2 seconds. Just buck it up, sister, and get your rectal exam.
Yeah. All right. Oh, and just speaking of last conversation point, we were talking about antibiotics. The other thing to think about to control your microbiome is not having too much alcohol, right? So if we're having a bunch of fiber but washing it down with like 3 bourbons, like that doesn't count because that alcohol is also not very supportive. So again, just thinking about protecting our microbiome as much as possible.
Yeah.
Okay. We're moving on to our tips or questions first, I think.
That's right. My favorite one is always first. Make sure that you're asking your doctor, what is my phase of ovarian function? It's just making sure are you in reproductive perimenopause or menopause? It just, again, can affect our overall feeling of well-being and symptoms. And again, we want to just check off the easy stuff.
Yeah. And just like everywhere else in our body, there's estrogen receptors, right? Even in our colon, even in our GI tract, and we can get changes with menopause that affect our day-to-day GI tract function. So good thing to remember. Number 2, have you asked me about my bowel movements? It's so funny. All my patients go, I'm so sorry to say this. I'm like, oh my God, I love it. I need to
Talk
know.
about poop.
Let's talk about your
All
poop.
the time.
Right? And any provider you see should at least say, what's up with your poops? Normal, not normal, feeling confident in that area, right?
Yeah.
And you should be honest if you're having too loose, too hard, anything new, all that's really important to talk about.
Yep, and especially a lot of women suffer from what we call a rectocele, or I jokingly call it a poop pocket. You know, a lot of women suffer from having a weakness in the wall between the rectum and the vagina. And if you're someone who has a BM, or you can feel the pressure of a BM, and you push and push, and all that comes out is a hemorrhoid, sometimes that BM has gone up into the rectocele. Instead of just sitting at the door for you to push it out, it's just getting pushed up into that pocket. And so it can be really important to even do what's called splinting, where you put your thumb in your vagina and push down on that pocket, and out it comes. So it's just really important. We don't want to keep all that BM trapped in there. And again, it can cause irritation and pressure. And the last thing you want is a hemorrhoid. So I always ask my patient, how many times does it wipe to get clean? And, are you able to fully empty?
Yes.
All right.
Number
What are
3.
my risks for colon cancer? So family history is a huge risk factor that should be always discussed when talking to your provider. Do you have other, what is your diet like? Are there other aspects of your day-to-day that may be increasing your risk? And it's worth that conversation. And, it's good to talk with, just get us buzzing about it so that people can go ask their doctors about those
Exactly.
possible risk
Lisa,
factors.
quick question from Lisa. Lisa, again, thanks you guys. I'm glad it's been worthwhile to stay on this long with us. Can too many supplements cause constipation, especially calcium? Kim, what do you think about this?
Yeah, I don't know if I heard calcium per se. Definitely would say that's true about iron. We don't want to have too much of those. I guess my immediate thought would be, if you're supplementing quite a bit, are you not eating enough fiber? Because you're maybe relying on the supplement. So, the fibers, and especially that insoluble fiber that's going to create bulk in the stool. Are you drinking enough water? That's another big part of it. Are you getting some movement in your day? If those are all issues, that may be more where the constipation is coming from. But yeah, I would be careful with how many supplements I'm taking.
That, and sometimes it's not the actual part of, it's not the calcium, it's whatever makes up the cake of the actual
I was
supplement.
thinking that too.
So you can always change out, you're like, I still want my calcium, let me just change out the form of it, maybe to a liquid, maybe something that's sometimes fat-based can be a little better, although it's not so much with calcium.
Yeah. Yes.
Yeah, or eating calcium, yeah.
Yeah, yes.
All
So
right.
we talked about this, number 4.
Where am I at with my cancer screening? We just reviewed, right? 45 for everyone, younger if you have a family history, a lot of options. We get it. If you're not ready for a colonoscopy that first year, at least do something, right? To get you going, just to make sure we're not missing something big. But it's always helpful to have a colonoscopy so that we're making sure we're treating any polyps that are there.
Cool. And number 5, what resources do you have to help me make better food decisions? So again, if you don't get to be at True, or you choose not to check out our resources, make sure you've got resources wherever you are with whatever healthcare provider you're seeing, because there are a lot of great resources out there. And, if you're, Kim, what suggestions might you have?
Yeah, I mean, honestly, it's simple advice. Eat whole foods, stay away from processed foods. Processed foods can damage the gut microbiome. Whole foods are going to give you your polyphenols, or they're going to give you your fiber. They're going to give you the different vitamins and minerals that you need. They don't have to be anything fancy or extraordinarily prepared. Sometimes just a good old roasted pan of vegetables will just be a great thing. So don't overthink it. Almost try to simplify it a little bit as best you can. Awesome. And lots of water.
Lots of water. Thank
yes.
You.
Less sugar.
Okay. Less sugar.
Yeah.
So now action steps you can take to improve your gut health.
What is your picture of self? I mean, this is what I've learned from Mia True. How important is goal setting? Where do you see yourself in the future? right? And sometimes, I mean, it's rare that people are like, I want to be bent over having constipation and bloating. So I can't say I've seen that. So just reflect a little bit on where you want to go. And sometimes that means making some changes to your diet or adding in seeds. So I would do any one of those things and just take a small amount of time to reflect.
How do you want to be? Yep.
Yeah.
Number 2, it might be difficult or hard, but let's think about cancer.
Yeah,
You got to think about it to deal with it.
Yeah.
Yep. You know, I will hear a lot, oh, like, I don't want to maybe do a screening test because I don't want to know. And oh, that like just twist in my stomach because you got the sooner we know, the much higher the odds that you will be cured and that you will be able to continue on with life. I mean, anyone in the medical field has seen people die from cancer. Anyone honestly in this world have seen people die from cancer. And whatever we can do to understand our risk factors, know what our screening options are available, pay attention to symptoms that are lasting longer than 10 days. All those things are worth a thought, and pausing on our day-to-day work and family and all that different stuff just to give it a pause to think about it.
Yep. I remember hearing of a GI doctor who kept putting off a colonoscopy because he thought his risk was low. And by the time he did his colonoscopy at 53, he had stage 4 colon cancer.
Wow.
So again, it's one of those things that, again, ask yourself, do you want cancer? Or you say, well, no, of course I don't want cancer. Well, really? Prove it, right? Prove it. So it's a little harsh, but true. Number 3.
Fight for the health of your microbiome. Think about what you're eating in your diet. Is there anything you can do to improve? Maybe it is just throwing a handful of raspberries on your salad or adding them to your oatmeal or doing these little things to really keep your microbiome as healthy as possible.
Yeah.
Well, okay. Think about your poops. We want to talk about them. You got to think about them, pay attention to whether or not you find yourself getting way too loose or way too constipated. If you're having any new pain that's associated either with, we talk about just the urgency sometimes can be quite painful. That's not normal. If you're like having a lot of urgent cramping that before you have to go to the bathroom, if you find that, even with intercourse or you're feeling bloating or fullness in your pelvis, any of those things are worth a conversation with your doctor.
Exactly. Jennifer, I love your comment. Let's get that up there. This is a shout out. Any family history, get a colonoscopy. Thanks, Jennifer.
Thanks. Thank you. Yes.
And colonoscopy is a lot less painful than colon cancer.
It sure is.
Again,
all right. And our last tip, look for resources to eat healthier, right? Maybe reflect on your relationship with food. Do you need help with a food therapist? Do you need to do some mindful eating? Do you just need a meal plan from someone awesome like Kim, right? Seek these resources out to pull in other ways that you can look at to eat healthier. Look at your barriers and add some tools to bring them down.
Okay, everyone, rapid fire. What's your favorite recipe with fiber? Like if you could have a lunch of anything you want, what would it be? Kim?
Oh my goodness. I mean, there's so many things I love to eat with fiber. I mean, I love anything with avocados.
She stole mine.
Oh, I just love avocados. I would eat an avocado with in fact, that was my afternoon snack today, avocados and tomatoes.
Oh, awesome. Celia?
I love like a good guacamole that I'd eat with like cucumbers. I think that's great. I also love chia seed pudding. I feel like that is very treat with chia seeds and just a little bit of milk and vanilla. And you can add some berries or whatever you like, nuts on top. It's a nice treat.
Dr. Egan, I'm going to find a recipe for that and add it for you.
Awesome. Thank you.
Sometime next month.
And I love a salad with like farro that I've cooked with olive oil and then put that even room temperature on especially arugula, Parmesan cheese, a little avocado.
Nice.
Oh,
sounds
my
great.
absolute favorite.
That sounds
salad with farro. So Kim, if we could have that on our meal plan.
Okay, I'm writing that down now. Farro salad.
Thanks so much. All right, everyone. It's been a great hour together. Thank you so much for joining us tonight. We wish you good gut health.
Thank
you, Kim. Great job.
Thanks. Have a great night.